abran los ojos y vean lo que está pasando. Es una explotación lo que está haciendo Stanford. Les pido atención a todos los estudiantes de la Universidad de Stanford, que presten atención, que los que les están limpiando los dormitorios, quienes están limpiando y cocinando en las cocinas, somos las personas que tenemos el sueldo más mínimo. Nosotros nos estamos partiendo el alma limpiando lo que ensucian. Ayuden a que nos den un sueldo más alto. No estamos pidiendo nada del otro mundo.
The Missing Class is a book about the near poor in America, and it turns out that's a very large group of people. In 2007, when I finished the book, there were about 37 million Americans below the poverty line, but there were 53 million Americans in this group of the near poor who are 100 to 200% of the poverty line. And we pay very little attention to them, both in policy terms and in public awareness. I wanted to draw attention to their situation, both the good news and the bad news of their conditions, and I think that's become an even more acute issue now in the economic downturn. In addition to the near poor being a very large group of Americans, they also have some special problems that we need to pay attention to, that we tend not to attend to because they're different from the poor. First, they're in debt. Debt is a big issue for the near poor, and that's partly a reflection of their success, actually, because many of the people that we studied for this book had come up from poverty and were now working many, many hours in order to amass a better income profile for their households. But with those many hours of work came expectations for a better standard of living that tended to outstrip their income. So debt is a big problem for the near poor. They are bombarded with predatory lenders who are looking to lend them money, and they are at risk for losing what they have as a consequence of debt. This is also a group that is highly represented in the uninsured population because they earn too much to qualify for our public programs, Medicaid principally, but they don't work for the kinds of employers who offer private health insurance. So they are in that group that is sorely in need of health insurance, and their children will benefit enormously from the S-CHIP program.
It's tough also for our 6-year-old mother of 3 who drives a school bus full-time and has to work a second job to make ends meet.
My janitorial service side job, I normally do 3 days out of the week in the morning time in between my split shift, and sometimes 3 days out of the week in the evening time. At my school bus job, I make $10.89 an hour. At my janitorial job, I make $8 an hour. It's not enough money to pay the bills or have gas or buy the $5 worth of gallon of milk. I had to get my gallstones removed. I was saving pretty much 9 months for a brand new car, and I had to take that money to pay the surgeons. I got a little help with the hospital bill while I was staying inside the hospital. But I was out of work a month and a half, and I got no pay. I had a job still, but if I didn't save a pretty penny, I would have been doomed.
Having no sick days hurts too, particularly because drivers get the same colds and flus that kids on the bus have.
Just 2 months before school let out, I got what they call a viral upper respiratory infection, and had 101 temperature, was trying to drive so I can possibly get a bonus, and I had to go to the hospital. It was $300 for the visit because they had to give me 2 shots, one for pain and one for penicillin. And I paid $300 for the visit and $75 for the extra antibiotic. Then they sent me to a throat and ear specialist. That was another $60. So we're talking about a good old $400 for that whole episode and 2 days laws at work with no
We
pay.
are about as Christians. We're also about justice. And the issue is that in order for a human being to live, a human being needs food, shelter, job, health care, housing. These are basic needs. In both the Old and the New Testaments, this is very clear in the message that comes through from the prophets in the Old Testament, who chastise the wealthy for not making sure that the poor have the basic necessities of life. This is very clear in Jesus, who, from his very first sermon, talks about the Jubilee, the year, the acceptable year of the Lord, and the time when the poor will have the good news preached to them, so that Jesus expects us as his people to make sure that every human being is given the support that they need in order to live. And that is what economic justice is about.
I think of myself as, well, I guess I am totally underinsured. Get reduced rate care or free care, but we don't make enough to be able to afford the premiums on a policy that would be enough coverage to really be able to meet the needs of our family. My name is Martha Martin, and I have 2 daughters, a husband. I work at the deli. I also am a Mary Kay consultant, and I work for Just Friends, which is a company that does non-medical care for elderly people. Butter, eggs, milk. Oh, do you need milk for the cat?
I need another quart of milk.
I have been told that I should probably see a counselor because I'm under a great deal of stress, but that's another thing to pay for, so that would probably just stress me out even more. The bills that I'm paying now, the medical bills that I'm working on, are probably, a lot of them are still leftovers from last year. I'm scheduled to have a hysterectomy, and what they're doing with the hysterectomy is they're saying that it's a pre-existing condition. When you look at your child, then it's a little bit harder to keep your perspective, and because you always want to, wave your magic mom wand, and fairy dust comes out, and it makes life easy for them. My 14-year-old is saying to me, "Oh, I don't need to go to the doctor for that, Mom. It doesn't hurt that bad. I can take it. I can take a lot of pain." You let your 14-year-old suffer because you can't take her to the doctor? I have actually started selling things off. The antiques are all things that were my mother and dad's. They were collectors. You decide what can you stand apart with. And, it is just stuff. I mean, it's emotional stuff, but it's just stuff, and it's not as important as the people.
That law. But let's go take my turn for questions. The stories we've heard here from this panel are heartbreaking, but unfortunately they're not unique. If I can go to slide number 1 there, the Commonwealth Fund Health Survey provides some remarkable data. If you take a look at right here, this slide's come, as I said, from the Commonwealth Fund report. We'll hear from Ms. Collins next. But I'd like to highlight the column labeled underinsured and a row labeled used up all savings, like this panel. According to the report, there were 25.2 million underinsured Americans in 2007. This table shows 46% of the underinsured burned through their savings in order to pay for medical bills. That's 11.6 million Americans with health insurance who still spent all of their savings on medical expenses. The table also notes, and you can see the arrows there, that 33% of those underinsured took on credit card debt as a result of medical bills. That's another 8.3 million people. Relying on credit cards, often with high interest rates to cover medical expenses, just leads to greater financial burden. I guess as the chart shows, I think the underinsured are just one step away of being uninsured in financial ruin. Mr. Wilkes, let me ask